Namaste everyone.
Namaskar, sir.
Okay, Anuradha ji.
Yes, is it okay, sir?
Sit on your mat. Then we'll talk about what we are going to do and what is this class about. Okay, just sit up straight on your mat. Take a deep breath in and then long exhale out. We'll begin today's session with 3 Om together. Take a deep breath in one more time. Join your hands together in front of your heart center. Bend your head forward and then open your eyes while blinking. Namaste to everyone. Welcome everyone in this Zoom online classes. I can see only one person, Anuradha ji. Okay. How are you everyone? All good? Okay, so this is your alignment class in which we are going to talk about that one particular posture and we'll have that maximum benefit from there and how are we going to get there and how are we going to get out of that posture. Okay, so have you taken this alignment class before?
Yes.
Yes, welcome back. Are you also here? Okay, so it's your first day in alignment class.
Yes.
So let's talk about any particular posture that you want me to discuss or we'll discuss all together. So please let me know that how long have you been practicing the experience that you have got in yoga. And if you have any injury, so we'll also talk about that. Okay. Yes, let's start with Katrina.
I have an old back injury that I have managed for the last 20 years doing yoga. But I've always been adjusted by teachers. Okay. So, yeah. But I have a basic understanding of where to push myself and where not to.
Okay, so do you have any injury?
Not only my back, yeah, just my back, but it's been a lifelong injury. So yeah, I've learned to manage it for about 20-25 years. So usually with yoga.
Okay, we'll yeah. If you have back injury, we'll try to build the strength of that particular region so that it's going to be released or it's going to be less. All right. Yes, Krupaji, how are you?
I'm fine, Ji. How are you?
I'm good. Nice to see you again.
Thank you, sir. So you were asking about which asana to get in. I forgot the name of this asana, but the thing where we try to bring our forward fold. This
we are going further. Just let me know about others. Like how long have
Oh,
they been
sorry, I
practicing?
skipped that question. Sir, it's only from last 6 months I'm a bit regular, sir. But whenever, sir, thing is, whenever I practice asanas, it's my body is like I get tired so easily. For example, nowadays I'm doing 108 Surya Namaskars. So I'm after that I'm not practicing anything else. I just do that and then I leave it, because after that I become tired and I don't have energy for any other vinyasa, ashtanga. I don't have energy. So this is what I'm doing. I'm skipping, but now I'm trying to, this month I'm trying to combine both. Morning I want to do 108 Surya Namaskar, and afterwards whatever you are teaching I want to do.
Okay, so what you are doing now? Sun salutation only?
So yes, sir, 108 times, sir. That itself will consume like 1 hour or 1 hour 15 minutes, like that it will consume. Hello?
Okay.
Yes, sir, that itself
Nobody
will
just
consume
keep
1
on
hour.
practicing. See, as I told you before, that that strength that takes years and years, but that flexibility that does not take much time.
Okay.
Maybe you can easily become flexible within 5 months, 6 months, 7 months, but strength that will take definitely so much time.
Okay.
Because in flexibility we have the, like, usually everyone can be flexible even after you don't do yoga or you do yoga. See, if people are too much flexible, like they can do deep back bend, so their muscles and your muscles, you're doing like intermediate back bend, that is also fine. They both are similar. But if you're talking about other person who is advanced, she is bending from her spine, so that is different thing. But if you're talking about the flexibility, that will come in your muscles only. Okay, understand this thing. If you are you're bending more than that 90-degree angle, that means level. Okay, the flexibility we are going to work on, and then mobility too, to bring that strength in your particular region. Okay. If you are getting too much tired, it means maybe you are doing wrong practice. Okay, it's not about just you keep on practicing and then you like build the strength. Okay, so it's about how you practice, because sometimes you like 3 days workout, then after you have to rest too. You have to work on the flexibility. The 4 days workout, again you have to work on that flexibility too. Okay. Just do not do anything like which is making you tired.
So
Get
for
tired with
instance,
the
so for instance, now this month, sir, 6 days a week we have classes. I think what is his name? Some teacher is taking class, sir, in the morning, and in the evening you are taking alignment. Saurabh, I don't know his name. There is one teacher, he's taking some like this morning we did sun salutation. So 6 weeks, 6 days a week if we do this, and along with this I'm also doing 108 Surya Namaskar. So this is okay, sir, or this is too much?
I could not hear you. I'm really sorry for this.
Oh, okay. Sir, yeah, there is some problem with the audio, I guess. Sir,
Others, can you listen to me?
Yes, sir. So my question is that, so I'm doing 108 times Surya Namaskar. So along with that, I'm also attending this class. So that class is like, I think 1 hour class. So these two together I can do, right? A weekly 6 days. So this is not too much, or is this too much? Because like this morning I did, and now itself I'm feeling too tired already.
Yeah, this is too much, because your body needs rest. If you do not take proper rest, then it will not convert into your strength. It will convert into your weakness. Okay, you just need to have rest too.
Oh,
okay.
Okay.
Okay, what about others? Is Naringa-ji, how long you've been practicing?
Hi.
Or if you have any injuries, please let me know.
So practicing for many years, intensively, I think for about 8. And yoga teacher Hatha Vinyasa and Yin since 2 years. Ashtanga I'm familiar with. However, I do not teach Ashtanga and I want to learn more about Ashtanga. No injuries at all.
No injuries at all. Very nice. And I cannot pronounce your name. What's your name? Ili.
Ailey.
Ili. Okay.
Yeah.
Ili.
I've been practicing probably like 15 years.
15 years.
On and
okay.
off. Yeah. And I did my 200-hour training a couple years ago. And I have a lower back injury that I've had for like 20 years.
Low back injury. Okay. Anuradha ji.
What?
You also tell about yourself.
Yes, sir. Actually, I started yoga here only. I was with you last month. And you taught me this.
Yeah, I am.
Yeah, so last month I was not able to do, I was not well. And I have to give the exam now, and so I wanted to be in the flow. So I want to take few more classes so that I'm flexible in doing while giving exam, it should be fine for me.
Okay, thank you so much. So let's begin today's session. So this alignment is all about the consciousness, conscious breath, and conscious movement. Okay, so we have to synchronize our movement with our breath so that we will understand the movement that happens in our body. Okay, within and around. Understood? So let's suppose you do any posture like warrior A, warrior B, or Veerbhadrasana C. Any posture, they will require to have limitation. If you are extending your joints too much, then you won't have the same benefit which you are looking for. Person to person, alignment gets changed. And so this alignment is going to create that, that stable foundation for the safe yoga practice. So that is why I asked you, like, if you have injury and then if you do not know the stable foundation for that safe yoga practice, then you may fall into injuries. Okay, so that is why person to person it is going to change. Okay, so if you are already flexible, if you're too much flexible, or you have good mobility, if you're getting into the posture, maybe you are not doing it wrong, maybe you are not doing it right, or maybe you're doing it wrong. So person to person is going to change. Even if you have that beginner, advanced, or intermediate, triangle pose, that will be different for them. Triangle pose, that will be different for advanced person, with the different approaches. Okay, so let's start with tabletop. So we'll understand with the basics. Just everyone please come up on the tabletop. So this is a tabletop in which you have to understand that foundation of your palms and foundation of your legs. Okay, so in this tabletop, your hands, your palms should be directly underneath your shoulders, and your knees directly should be underneath your butts. Okay, make sure you're not rotating your hands outward. Outer rotation means this. Make sure your eye of the elbows are facing each other if you do not have hyperextended elbows. If you have hyperextended elbows, make sure you're locking your elbows and then pressing your hands on the floor, pressing your hands into the floor. All right. And you're not contracting your scapulas together or protracting your shoulders. You should be stable. Your spine should be straight. See, in this tabletop position, make sure your scapulas are not together. Neither you're pushing your hands forward and taking your scapulas away from each other. Make sure they are neutral and stable into this position. And you cannot untuck your toe, depends. Your toes under. This is your untucked toe. right? But if you tuck your toes under, you will have more stability in your posture. But if you untuck your toes, then it will be hard to find that stability in your knee joint. Okay. Yes, everyone, please come up on the tabletop. Keep your spine straight, hands straight. Do not loosen yourself, just be active. Pull your arm muscles back and look front or look down toward the floor. Okay, if you just look down towards the floor, your spine, your head, back, neck will be in one line. But if you just look up high, and if you have cervical issue, then it is going to be a problem there. All right. So if you do not have cervical problem, then you can always look down to the floor or look up high. Like either way you can choose. But if you have cervical problem, do not look up high. Just keep your spine straight, neck back in one line. Okay. So with the next inhalation, we'll come up high, lifting our head up, and then making nice arch on our back. What do we call this? Cow or cat? This is your cow pose. Okay. And while dropping your head down, pushing your hips forward. This is your cat pose. When you lift your head up, this is your cow. But when you bend your head down, push your hips forward, this is your cat pose. Let's do it one more time. Inhale, lift your head up, make an arch on your back, pull up high. Exhale, lower your head down, hump on your back. Push your hips forward. Inhale, again lift your head up, make an arch on your back. Keep looking up high. Press your palms. Exhale, again lower your head down. Push your hips forward. Make a nice hump on your back, big hump on your back. Okay, so what do you understand when you were doing this cat and cow pose? When you were lifting your head up, then we had extension in our anterior group of muscles or in our upper body. Okay, front side. But if you talk about when we were doing this cat pose, you're having that extension on our posterior group of muscles or on our thoracic region, back side of your thoracic region. Understood? So this is how we are going to understand where are we feeling that extension, where are we having that engagement, how we are going to rotate our arms, and how are we going to protect our arms. Understood? So as you are doing this cat and cow, in this cow pose, you are just lifting your head up. You are having that all extension over here, but your hands are also supposed to rotate outward. Taking them inward, then you will start to collapse the shoulders. Make sure you're your arms, then pulling up high with the chest. And then by dropping your head down in cat position, you're going to squeeze in your abdomen, squeeze in your chest, and then pushing your hips forward. Okay, so let's do this cat and cow, everyone. And then if you feel anything different, then let's discuss about that. Just lift your head up, make an arch on your back. Where do you feel that extension? On your lower back, or on your thoracic region? And then exhale, lower your head down, hump on your back, push your hips forward. Yes, narrowing the hips forward, forward. Hump back. Make sure you're pushing your hips forward too. Okay, make sure you're pushing your hips forward and leaning forward. Is it going to get movement in your abdomen, in your lower abdomen, and the chest too together? Now again, lift your head up, make an arch on your back. Look up high to the ceiling. Just go slow. Exhale, lower your head down, hump on your back. then understand movement. Okay. So when you're lifting your head up, your hips are tilting forward. This is called anterior pelvic tilt. When you are dropping your head down, pushing forward, this is called posterior pelvic tilt. Okay. When you're making arch on your back, that is called flexion of your hips, or but when you're humping on your back, pushing your hips forward, that is called posterior pelvic tilt, or that extension of your hips. Let me hear one more time. So this is your anterior pelvic tilt. Your tailbone is getting high. But when you drop it down, pushing your hips forward, you're trying to squeeze in your butt, looking down. This is called posterior pelvic tilt. Okay. And when you're moving a hip forward, this is also called flexion. But when you're pushing a hip forward, this is almost a flexion, but we are trying to extend our hip or pelvic girdle. So there are a few movements that I want to introduce you guys so that it will be easy in the further classes. See, when I'm going to say rotate your arms outward, this rotation will be like this. This outer rotation will be like that. Okay, Anuradha ji, no worry. So when you're rotating your arms outward, this is going to be like this. But when you're rotating your arms inward, this is going to be like this. Okay. So this is the outer rotation of your arms. This is the internal rotation of your arms. Or outer rotation, internal rotation. Yes. Now bend your elbows and just keep your hands like this. This is the external rotation. When you are bringing them together, this is the internal rotation. Okay. So where do you feel comfortable? Where in which rotation do you feel that extension on your spine? When you rotate that outward or inward?
Outward.
Outward, right? So the tendency of your shoulder socket is to rotate your arms outward. That is, then you can extend your spine. Okay. The moment when you rotate your arms outward, you will feel the extension on your thoracic region. See, when the moment I start outward, you can see the chest is lifting high. It's going to be elevated. Keep elevating. When I'm bringing my hands together, it is going to be squeezed, or I will start to make hump on my back. Same thing applies in your cat and cow. When you're lifting your head up, you have to rotate your arms outward, pull up high. But the dropping your head down, just rotate your hands inward, so that you will have that more engagement, more contraction in your chest, in arm muscles too. Understood? So in this cat and you have so many variations. If you guys know any variation, just show me so that, yeah. Do you guys know any variation in this tabletop or cat and cow?
Yes, you can rotate your hips in circles, figure 8.
Yeah, show us so that you just told me. I understand that. Can you hear?
No, it's breaking.
Okay, so in this cat and cow, we do have thread and needle. Okay, thread and needle. Maybe you guys know already. So your one arm up over the head. Again, we are extending our spine. Make sure your hand is rotating outward. If you're rotating your arm inward, you cannot extend it upward because your deltoid is collapsing into your front deltoid. So there we do have 3 head in this deltoid: lateral, medial, and anterior. Just pull up, rotate your arms outward, and then sit underneath your left armpit, and then stretch your other arm over. Okay, again, rotate your hand up, down. Open up your chest. Keep opening. Exhale. Place your left hand on the floor. Stretch your right arm up over the head. This is called thread and needle. Let's do this from the other side too.
Sir, I can't see your video at all, sir. It's completely blank.
Now take your left hand up over the head.
Yeah, you've actually frozen.
And up over the head. Yes, what I was saying, let's do this thread and needle from the other side. Now keep your right hand on the floor and then stretch your left hand up over the head. And then exhale, swing your left hand underneath your right armpit. Very nice. And then stretch your other arm over the head. Good job. Now keep stretching. If you rotate your upper hand outward, like rotate that outward again, reach your pinky finger high. Yes, Nariga ji, rotate it outward, it's inward. Yes, this is outer rotation. Okay, just keep rotating your hands outward and keep pulling your bottom hand forward. Just keep pulling your bottom hand forward so that you will have more twisting from your thoracic region. Okay, keep rotating and then exhale, release back, place your right hand on the floor and then stretch your left hand up over the head. Again, get back to the previous position of the tabletop. Okay, so this is how we do this thread and needle. In this thread and needle, we do have other variation too. Yes, Krupa ji, do you want to ask anything? Okay. So in this thread and needle, we do have another transition too that we can also do right now. Again, take your right hand up over the head. Let's do it one more time. Take your right hand up over the head. Exhale, swing your right hand underneath your left armpit. Good job. And then take your left hand up over the head. Take your left hand up and then wrap your left hand behind your back. Wrap your left hand behind your back and try to grab your right thigh. Good job. Now tuck your toes under. Tuck your both toes under. Yes, just find the balance in this position and keep twisting your spine. Look up high to the ceiling. Just stay there, stay there. Very nice. Now from here, try to lift your left leg off the floor. Send your left leg back. Just find the balance in this position. Yeah, go slow, find the balance and then hold. 1. Keep pulling up high. 2. 3. 4. And 5. Now release your left leg on the floor and then again swing back in to the previous position of that thread and needle and release your hand down. Good job. Now let's do it on the other side. Stretch your left hand up over the head. Stretch your left hand up over the head. Exhale, swing your left hand underneath your right armpit. Now take your right hand back, wrap it behind, and then try to grab your left thigh. Now keep opening your chest with every exhalation. See, whenever you want to try to get into the posture, make sure you're exhaling. If you want to go deeper into the posture, make sure you're exhaling. Okay, but continuous breath should be there. Now, tuck your toes under, lift your right leg back off the floor. Good job. And keep twisting. And then hold. 1. Good job. 2. Keep trying and find that stability, find that balance on your feet. 3, 4, and 5. Now release back down. Place your hand on the floor, place your leg on the floor. Again, come up high to the previous position. Exhale into the tabletop. Just see how you are finding the balance on your leg. In this alignment, we are also going to talk about that stability. As I told you, that stable foundation should be there to have that safe yoga practice. Okay, that stable foundation should be there. So as you are doing this thread and needle, in this we were tucking our toes. If we do not tuck our toes under, we can never find the balance because it's going to be very hard to find that balance only on your knee. But while tucking your toes under, you bring that more awareness in your knee, in your hip joint, in your arm muscles too, all together. So what does it mean? We are bringing that information from the floor. Okay. So in order to bring that information from the floor, we need something to be, more conscious. So here our toes are working like that courier or carrier, something like that. So this was your thread and needle in this position, in this variation. If you guys want to ask anything about this, this thread and needle or rotation of your arms, then you may ask. Otherwise, we'll go further. Okay. See, in this tabletop, our hands and our legs will open according to the shoulder width apart and according to our hip width apart. If you open your legs less than hip width apart, then again you will create the space over here on your outer or lateral side of your pelvic girdle, like in between your, this is called femur bone or pelvic girdle. You will start to create that space. But if you keep your hip and your knee in one line, then it will be more stable. But if you're keeping your hands like less than shoulder width apart, then what is going to happen here? Again, you are creating a space more than this part. Like you are contracting this muscle and this muscle is going to create more space that we don't need to do in this tabletop. Make sure your hands are open with shoulder width apart, legs are open with hip width apart, and then after you're going for the this cat and cow position, cat and cow pose. Okay. See, when you're doing cat pose, this is called protraction. When you're doing cow pose, that is called retraction almost. Okay. So the protraction is something in which you are sending your scapulas away from each other, but is retraction when you're bringing your scapulas together. Just understand these terms because these terms is going to help you out when you are going to go for the inversions. Okay, the protraction of the shoulder is this one, but the retraction of the shoulder when you're bringing your scapulas together. Okay, now one more time. While pushing your hands forward, this is called protraction. When your scapulas are getting away from each other, when you're bringing your scapulas together, this is called retraction. Let's do it all together one more time. When your hands are pushing forward, when you're pushing your hands forward, this is protraction. When you're bringing your hands together or scapulas together, that is called retraction. Okay, so this protraction and retraction help us out from that back injury or that shoulder injury too, because stiffness in our shoulder socket, then it allows our scapulars to move more further out, and then it creates space that stiffness remove while moving this like this movement is going to give you a lot of space in your scapulars. Okay, so this protraction and retraction that we can also do in the tabletop. So let's suppose, just come up into the tabletop, everyone. See, earlier we were doing cat and cow, but now we will do only retraction or protraction. Okay. So without lifting our head up, keep your head in line with your spine. Now bring your scapulas together and then exhale. Just look at me here, then you will understand. Earlier we were doing this cat and cow, but now we are only doing this retraction and protraction. This is called retraction and then protraction. Retraction and then protraction. Again retraction and then protraction. Just keep moving your hands without moving your spine. Just move your scapulas. Yes, retract them, protract them, retract them, protract them. If you're looking for the strength, always try to go for this exercise or this movement. This is going to give you a lot of, strength in your arms. And because ultimately we need to have, like when you're going for the handstand or any other poses, like inversions, where we need to have a lot of strength in our arms. At that time, this strength will help you to get there. Okay, like crow pose. In crow pose, what happens? You press your palms, like this, and then you get your knees on your elbows, and then you try to protract your shoulders. Right? So again, you are protracting your shoulder blades. The moment when you protract your shoulder blades, here we have like serratus anterior muscle. This is going to be engaged. Then the moment when you engage this serratus anterior, your scapula is also going to be engaged. Ultimately, they all are connected to each other. Got it? So this protraction, retraction, if you can control it there, or you can engage, you can sustain that engagement there, then it is going to take you to another level. If you don't understand this basic movement, then it is going to fix you in the same level. Okay, so we'll work on basic things, then we'll move further into advanced or intermediate things. Okay. Yes, Joy, this is retraction. Just look at him, how he's doing. This is retraction and this is protraction. Retract and protract. Okay, so from here you can also do plank pose. Yes, do plank pose from here. Just send your knees back. Very nice. Just look at him now, how he's doing this plank pose. Again, we need to have this. See, this is the protract. Yeah, just move. Move, Joy. Yes, this is retraction. When he's pulling his chest high, this is protraction. Okay, just look at him, how he's making arch on his lower back. This is not a proper plank that we are looking for. Just squeeze in your hips and then lean forward, slightly lean forward. And then again, protract your shoulders. This is retraction. Protract your shoulders. Yes. And then squeeze your tailbone more in. Yeah. Now this is like proper plank. Understood? Your hips should be always below than your shoulders, and your scapula should be away from each other. Yes. Okay, this is your plank that you did just now. Okay, so in plank position, your hands should be like, your shoulder blades should be away from each other. How is going to be away? When you're pushing your hands forward. But when you're bringing your scapulas together, then you won't have that that engagement in your serratus anterior. See, when you're pushing your hands forward, you will feel that engagement here. When you're keeping your hands beside of your chest, that will be loose. That will be collapsed. Okay. So in any inversion, crow pose, headstand, or anywhere you are in your arms, we need to have this engagement, this scapular engagement and this serratus anterior engagement. Okay, even in sarvangasana or shoulder stand. In shoulder stand, we do engage these things too, these muscles too. Got it?
Mm-hmm.
If you guys want to ask anything else, you may ask now. Okay, let's do few movements so that your body gets warmed up. Okay, everyone please sit up straight on your mat into simple cross legs. Now keep your spine straight. Now as you inhale, stretch your arms up over the head, all the way high, and then exhale, lateral bend to the right side. Right hand on the floor, and then stretch your left hand over the ear. Stretch, drop your right elbow down, drop your right elbow down, and then take your left hand up over the ear. Stretch. Now inhale again, come up high, take your arms up over the head. And then exhale on the other side. Lower your left hand down, stretch your right arm up over the air once again. See, when you're getting deeper into the posture, you have to exhale. When you want to come out of that posture, you have to inhale. Again, inhale, come up high. Now we'll do twisting. Drop your right hand on your left knee, left hand back on the floor. Inhale, lengthen your spine. And then exhale, twist your spine back. And then hold here for 3, 2, and 1. Again, stretch your arms over the head. And then exhale on the other side. Grab your right knee with your left hand back on the floor. First, you have to inhale. While exhaling, twist your spine and then look back. Hold there for 3, 2, and 1. Inhale again, stretch your arms over the head. Now grab your elbows together with your both hands. Now pull your hands back, keep your spine straight, and slightly make an arch and look forward. Keep pulling up high and feel that extension over here in your thoracic region, okay? Just feel that extension over here. Keep pulling your hands back. Keep pulling. And then extend your right hand up. Just take your right hand up, grab your left elbow. Just grab your right elbow nicely and then lateral bend to the left side. Now inhale again back to the center. Now grab your left elbow with your right hand nicely and then again stretch on the right side. Just keep looking forward. With the next inhalation, again come up high, stretch your arms over the head. And then exhale, release your hands down. Now roll your shoulders up, back and down, go slow. Keep moving your shoulders up, back and down. And then relax your mind, close your eyes. Breathing and then exhale. Now we'll chant 1 Om followed by 3 Shanti all together. Take a deep breath in. Shanti. 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 Join your hands together in front of your heart center. Bow your head down to the God. Honor yourself, honor your practice. Open your eyes while blinking. And namaste to everyone. If you guys want to ask anything, you may ask about today's session. If you guys get confused in outer rotation, internal rotation, that we are going to understand like after 1 or 2 days, that will be very easy for you. Maybe there were few difficult terms that I was using, but that is going to be okay by the time. Okay. Now enjoy your day. Bye bye. See you in the next class. See ya.
Right. Namaste.
Namaste.